I remember the day that I found out I was pregnant. I immediately thought about what this little life would mean to me, what the pregnancy would look like. I thought about nursery colors and names. The first time I heard her heartbeat, I'm pretty sure mine stopped. For a second. This was her only hope, and what I learned that day and the many days that would follow is that I would do anything for her. The early days of a micro-preemie are earth-shattering for families. I remember being numb and fighting back tears as I told her I loved her. I remember having to have the unreal conversation with my husband about how we were going to pay for all of this. A woman said that we could apply after 30 days and that Medicaid would help to cover whatever part of our hospital bill that our private insurance did not. It was hope. It was hope that we wouldn't have to make a medical decision based on cost, that we wouldn't have to sell our house or take out a second or third jobs to pay our bills. On February 22nd, Josephine was finally discharged and came home for the first time after spending 407 days in the hospital. She came home still requiring support of a ventilator, which connects to her through her tracheostomy. She is now medically complex. Her care requires quite a bit of coordination, from medical equipment to appointments to home nursing. Just like the early days of NICU, we have adapted and will continue to do anything that our daughter needs to thrive. If the bill proposed by the Senate were to pass, it would be devastating for our family. Lifetime and annual caps would be quickly met. Monthly medical expenses that top $26,000. Insurance would be billed at about $312,000 a year. And that is, of course, assuming that she stays healthy and doesn't require an ICU visit. Cuts to Medicaid are equally as damaging. First, if we lost our primary insurance due to caps, then we would have to rely on Medicaid even more heavily than we do now. Second, states would need to make some serious decisions if Medicaid funding is cut at the federal level. Are they going to choose between our grandparents, those with disabilities, or our children? Children like Josephine. Health care should not be a luxury afforded only to a few. No parent should have to worry how they will be able to afford their child's medical equipment or their surgery. Medication. Raising medically complex children is hard. Being insured shouldn't be. I have never lost hope in my daughter. That hope is what drives me to continue to fight for her, even if it means fighting for her right to have access to affordable, quality health care. Because with health care, her possibilities are endless. But without it, it could mean the end.